Roger is a patient that came in immediately before Christmas. He was a gentleman in his 60s who was attempting to go to the bathroom and passed out on the floor. And when he awoke, he was paralyzed from his neck down.
As it first happened, I was in and out of consciousness, but I was really frightened when first of all, I couldn't move my legs or my arms.
Unfortunately, when he passed out and fell onto the hard surface of the bathroom floor like a rag doll, he didn't have any support from any of his normal muscles because he was unconscious, and allowed all of that really significant arthritis to really hurt the spinal cord.
It was the very first time that I met Dr. Stachniak. I had never had an occasion to use a neurosurgeon. I was totally impressed with how she came across as being very confident. Also, I mentioned earlier her bedside manners, the way she just held my hand and gave me that feeling that it wasn't just going to be a business deal, but it was going to be personal.
We had to reconstruct his spine from the front and the back to take away really severe degenerative stenosis that he had developed over the years that was totally unbeknownst to him. It was a very complicated surgery that was about 5.5 hours. And after surgery, we had felt that everything went perfectly, but unfortunately he could only have some flicker movements in his extremities.
And I think one of the things that I wanted to happen was I just wanted to be well fast.
And it wasn't until a couple of months after surgery that he really started to see big improvements in terms of his strength and actually starting to gain the function to be able to walk. And then as months started to progress after that, many really significant kinds of improvements started to happen fairly quickly.
And then finally you get that courage, you get that feeling in you that that you can beat this thing, that it can happen.